Welcome to Beyond the Dental Chair, the podcast for hygienists looking to expand their skill set, think outside the box, and make an even bigger impact on their patients' overall health. I'm Brittany Murphy, the myohygienist and your host. I'm a myofunctional therapist and educator, and I'm excited to be here to help you navigate this journey into airway health and myofunctional therapy. Today, we're going to dive into a topic that I love, one that many hygienists grapple with when introducing an airway screening or a myofunctional therapy evaluation or screening into their practice. How do I explain this to the patient? Why am I doing this? Especially if it's the first time that they're hearing about it. Now, whether you've been a hygienist for a year or 20, you're adding something new, and this can feel intimidating, especially when you're worried about how your patients might react or respond. But trust me, with the right approach, your patients will not only appreciate it, they're going to see this as that extra care TLC step and expertise that you're bringing to their overall health. So let's get into it. So I want you to imagine this, okay? You've just seated your patient in your hygiene chair in your operatory. They're here for a routine dental cleaning, and maybe they're a little tired, or maybe they're already asking, when are you going to be done? You almost done? Life is busy. I have to get somewhere. I have to get back to work. I have to bring my child to soccer practice. Now, this is where it's important that you set the tone because you're going to be having this new addition into your routine. You want to make sure that you lead always with empathy and transparency. So I want you to frame it as something that you're doing to benefit them. So you're going to start by saying something like, today I'd like to include something new into our routine care. It's called an airway health screening. It's a quick, easy way for me to check for signs of your breathing patterns and your muscle function that could really be impacting or affecting your sleep, your energy levels, and even your dental and oral health. So you want to make sure that how you're phrasing it is going to tie into the screening directly and how it is really directly linked to their overall health, their well-being. You're making it about them. You're not just adding another task to your day. Now, of course, with anything, it's important that you're explaining the why behind it. So I want you to just briefly explain why you're doing it without trying to overwhelm them with all that technical jargon, right? Save that for when you talk to the doctor. You could say something along the lines of, and be honest. I always say be honest, be upfront. Patients are really going to appreciate that. So say something along the lines of, I've been learning about the connection between the way that we breathe and our overall health. I'm starting to notice how things like mouth breathing, tongue posture, even snoring can relate to issues like gum disease, cavities, or really just feeling tired throughout the day. This screening is going to help me look for those patterns so that we can catch them early and support your health and get you to the right providers. So, explain why you're incorporating the screening. You're going to show them that you're vested in their long-term health. You're not just looking at their teeth, right? We're looking at the whole body sitting in the chair. Now, again, sometimes this can be a little overwhelming. So you want to make sure that you reassure them about the process. So you might already start to see, some hesitation, maybe some eye rolling. Maybe you sparked some curiosity, but, let's face it, it's going to feel a little bit weird because this is the first time that you're going to be doing this. And you might have been seeing these patients for however many years you've been a hygienist times, 2 to 3 times a year. Somebody else do the math. It's way too early for me to be doing that. So this is a good time to just kind of reassure them about what they can expect. So say something like, don't worry, this is going to be quick and easy. I just have a few questions. I'm going to make a few observations about your mouth and how your muscles are working together. And it's painless and it's going to give me valuable information. Okay. It's going to keep it light. It's going to keep it approachable. And everybody, especially patients, love when you make things feel easy. Easy, not scary, pain-free. In doing this, you're going to be able to start just planting that seed for collaboration. Okay. So you're going to plant that seed for their involvement in their own airway journey. And also how, you're not going to say it this way, I'm saying this to you, but how we're going to start to plant that seed for how it kind of takes a village, right? That collaboration is really key. You're going to be doing the screener. You're going to be making, referrals or recommendations to seek other providers. So just let them know that there is an endpoint to the screener. There is something that's going to come of this. If I notice anything that could benefit from further evaluation, we can talk about some very simple next steps, whether it's tips for better breathing, better muscle function or oral function, connecting you with someone who specializes in airway health. So this is just going to really help open that door for future conversation, for sparking, that conversation, whether it's a conversation that kind of ends at that appointment and maybe you can, revisit in their 3, 4, 6 month recare appointment. But it's really going to reinforce your role as an advocate for their health, for airway health. Okay. Now, one of the questions that I get asked the most are, or not questions, I guess I should say concerns, are the questions that patients are then going to ask. And how are you going to confidently and clearly answer these questions? So I would say some of the most common questions that you might hear from patients in regards to implementing an airway screener, a myofunctional screener, are questions like, first, why has nobody ever done this before? And be honest. Again, honesty, transparency, those are the greatest things to have. That's a great question, Mr. Johnson. There's a lot of research that has developed in airway health. It's come a really long way recently. We have a lot of, providers tirelessly working. Sorry, guys, I haven't had enough coffee today. This is my first. I'm really getting into this whole podcast thing again. I took a long break from my other podcast, I Spy with my Myo when I had my twins. And I'm really wanting to start this podcast more for hygienists that really aren't into myofunctional therapy or are into it, but don't really know how to implement it in their dental setting or dental practice. I transgress there. I kind of went on a little tangent, but you're going to hear me fumble words because my girls are going through a major sleep regression. So I haven't had enough coffee. So excuse me there. But what I was saying was, so somebody asks, why haven't you ever done this before? You're going to tell them, that's a really great question. You're going to explain how there's, more research that's emerging. And many, other dental professionals are really starting to incorporate this. It's actually our responsibility and our duty as healthcare providers. And it is. You don't have to get into the fact that the ADHA, passed in 2023 that hygienists need to screen for airway issues. You don't have to get into all of that, but you can say that it's our professional duty and responsibility. Say that you want to stay ahead and you want to bring this added value to my patients. I care about my patients, not only their oral health, but their overall health as well. Now, they might come back and say something like, is this really necessary? And you can say, it might not be necessary for everyone, but I have found that it's always better to be proactive. And this screening, again, it's quick, it's painless. It can really help us identify potential issues early on so that they don't become bigger problems later in life. So try to be confident, be compassionate, be empathetic. Build that trust. You already have that trust from, being their hygienist for X amount of years. They probably already feel like they're in great hands, and they're only going to continue feeling like they're in great hands because you're adding this, again, completely valuable screener. I should say it's invaluable. So, keep in mind that most patients don't know what they don't know, just as we don't know what we don't know until we learned it. And now we're, down these airway rabbit holes and tangents and things like that. So when you introduce something new, when you introduce something like an airway screener, for the most part, you're opening their eyes to a new level of care, a deeper level of care that maybe they didn't really even expect. To be happening in their dental routine dental hygiene, dental recare appointment. So as if you don't already, because I know you do, but it's going to continue to make you stand out as a truly, truly exceptional hygienist, always going above and beyond for their patients. So I hope that this was helpful. We're going to talk lots more on this. Again, my passion, my goal for 2025 is to really bring this to the forefront of practicing dental hygienists because we see our patients the most out of any other healthcare field. So thank you so much for tuning into this episode, the first episode of Beyond the Dental Chair. If you found this episode helpful, please be sure to subscribe, share it with your colleagues. And next week, we're going to dive into something even further. We're going to learn how to spot the most common airway issues during a routine hygiene visit. So until then, keep thinking beyond the dental chair. Bye for now.